Morgantown Health Right is a primary care clinic that provides health care at no cost. Its patients are the uninsured or underinsured low-income residents of North Central West Virginia. Laura Jones is the executive director at Health Right Clinic in Morgantown. Years of experience have given her unique perspective on health care.
Health Right is based on the philosophy that health care is a right, not a privilege, that everyone should have the right to basic health services. And our mission is to provide that care through direct practice, direct service, education, and also advocacy.
Jones says the existence of certain free clinics is crucial. West Virginia is among the poorest states in the country, and there are not enough clinics to cover the whole area. Some of the resources now cannot accommodate people's needs. Clinical Service Coordinator Deborah Meadows feels the increase of the deprived population makes the problem even more urgent.
We have almost doubled on the homeless situation, and the Bartlett House is overfilled. They are doing the best they can. They have had more beds put in. Well, with a lot of people losing their jobs at this time, so they're losing their health care. If their money is financial, is low, their economics, the first thing they will give up is their medicine in order to put food on the table.
Clinic officials say about 5,000 clients visit Health Right each month. Among these are some people dealing with different diseases for years. Peggy Kistner is a housewife and a mother of 4. She has been struggling with diabetics for years and is not satisfied with the current system.
I think about the only ones who could afford it would be the coal miners.
Kistner says the problem is not from healthcare cost. The rising cost of daily living makes paying for medical care a burden.
If we do one thing, then we're going to hurt another thing, and it raises your utility bills are being raised, your utilities. Because once your water raises, your sewage raises.
Many Health Right clients have just obtained a medical card, and they still come to the clinic for regular checkups because it is much cheaper here. Dennis Keenan has been on seizure medication for a few years. He agrees that a lot of people are on a tight budget with health care.
Health care is a problem, and it shouldn't be put on the taxpayers to give a person a medical card, but then again, what are you going to do?
Physicians say Kistner and Keenan are to some degree representing a huge group of people in the state. Not everyone who seeks free medication is jobless, but this economy is making Health Right Clinic a necessity in local communities.
I think we are the only place for people without insurance to come and get free care. And I think that one of the reasons that people who are coming here continue to come here is because we try to be patient-centered as much as we can and provide as many services in one place. We have people who come and see their primary care provider and also have maybe a visit with a counselor. They get their medications. They might shower here if they're living on the street. I mean, there are lots of things that can happen here, and we try to make each visit as productive as possible.
And she ain't supposed to.
Free clinics in town are helping in a way that general hospitals can't. These two types of medicine here, metformin and glipizide, are considered to be the common treatments for diabetic patients. But guess what? They can take out of hundreds of bucks out of your paycheck at a regular hospital. But here's some good news at Morgantown Health Right Clinic. Regular customers here can just take their prescription here and they can get medicine they need for nothing. Nurses at the clinic say it seems almost impossible to meet everyone's healthcare needs. They say the state towns with a large student population can sometimes complicate a problem.
The other thing about our town is that because of student housing, the cost of housing is driven higher and higher. Rental costs go up, up, up. Our patients also have difficulty, as do all of us, sometime or other, have difficulty understanding. Health literacy is an issue, understanding what the doctor tells you, and that's a big issue. We desperately need some kind of healthcare reform.
Some patients say without free clinics, people will go without care.
If it wasn't for places like Health Right, a lot of people wouldn't have nothing.
Local care providers are working closely with social workers and humanitarian organizations like the Bartlett House and Mylan Pharmaceuticals to shoulder the burden. Health Right managers say they hope all the actions can raise governmental and public awareness of the situation of those in need. Boyashu, WVU News, Morgantown.